Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
As HPV silently tightens its grip across India, the rising numbers demand urgent attention. Once considered a distant concern, this virus is now emerging as a pressing public health challenge. From cervical cancer to other HPV-related diseases, the stakes are pretty high. But the awareness remains alarmingly low. In today's discussion, we bring the spotlight on this growing threat, the need for early detection, and the powerful role that prevention can play in changing the narrative. Welcome, everyone. I'm Dr. Samya Saluja from Thip Media, and today we are addressing a pressing public health concern, the rising cases of HPV infections in India. And to help us understand the gravity of this issue, we are joined by the highly respected medical expert, Dr. Anjana Chauhan. Dr. Anjana Chauhan is a distinguished gynecological oncologist with over 28 years of experience in women's healthcare. Her extensive expertise encompasses cancer treatment, gynecological surgery, and cancer screening. She earned her MBBS, MD, and DGO from BJ Medical College in Ahmedabad, Gujarat, laying a robust foundation for her medical career. Throughout her illustrious career, Ma'am has held significant positions, including Associate Professor of Gynecological Oncology at the Gujarat Cancer and Research Institute. She also served as Professor and Head of the Gynecological Department at Swami Narayan Institute, Kalod, where she played a pivotal role in academic leadership and mentorship. Her surgical proficiency is evident in performing complex procedures such as Wertheim's hysterectomy for early cervical cancer and staging laparotomies for ovarian cancers. Beyond her surgical contributions, Ma'am has been instrumental in cancer screening programs and public awareness initiatives. Ma'am's commitment to advancing women's health led her to establish the first HPV clinic in India with the aim of enhancing awareness and prevention of HPV-related diseases. In addition, the clinic is equipped for advanced colposcopy and vulvoscopy procedures. Her dedication has been recognized with numerous accolades, including the Best Paper Award at Tata Memorial Hospital in 2004, the Dr. T.B. Patel Young Research Scientist Award, and Dr. Sirish Daftari Award in 2007 and 2010, respectively. She is an active member of several esteemed medical associations, including Federation of Obstetric and Gynecological Societies of India and the Indian Medical Association. In addition to her clinical academic pursuits, Ma'am has made extensive contributions to the medical literature with several publications in national and international journals. Her unwavering dedication to patient care, education, and research continues to make a significant impact in the field of gynecological oncology. Dr. Anjana Chauhan, Thip Media welcomes you, ma'am.
Yes, thank you, Dr. Soumya Saleja. And I am very happy the initiative taken by the Healthy Indian Project for this subject, which is a burning issue, HPV. And I'm very happy to be on this platform to give correct message to our audience and our young people. Please, Soumya, now let's move forward and let's talk about this issue.
Ji, ma'am. And thank you so much for your valuable time today. Ma'am, like you just mentioned that HPV is a burning topic in this country. So you are very well aware that there has been a significant rise in HPV-related infections and complications over the past few years. And given your extensive experience as a gynecological oncologist, and of course, your dedication to promoting women's health awareness, I'd like to begin this discussion with a very simple question: that what is this human papilloma virus, and how is it commonly transmitted?
Uh, Human papilloma virus is known as an HPV, and this is what we can say a DNA virus which has been existing since long. It was
Ji,
discovered in 1980 by Dr. Harold Hussein, and he got a Nobel Prize for it. And he
ji,
was under the impression that some type of virus is there which is responsible for causing cancer.
हाँ जी,
And HPV virus, that way it was discovered and he got a Nobel Prize. And that changed whole scenario for survival. What is the most common, the cervical cancer screening that we are moving forward for HPV. And this is a huge, what we can say, a biggest discovery of 20th century, we can say. And
ji,
about getting HPV, HPV is a silent killer. It's a virus which not cause any symptoms. So
ji,
it spreads from one person to another person. It spreads from human contact to human contact.
हाँ
Mostly
जी,
there is a myth on the media that it is sexually transmitted. Yes, it
हाँ
is
जी,
sexually transmitted. It is from skin to skin contact. Okay.
okay,
So we can consider it as a sexually transmitted, but there are non-sexual way of transmission also. It is basically skin to skin spreading and through fomites. So if you are using a common bed sheet, or if you are using sanitation, we know the general sanitation hygiene in India, what the conditions are there. So you can get HPV from anywhere. So you need not worry where this virus came and what has happened. Main thing, what is this virus causing to your body and what should you do to protect yourself? That is important.
मैम जैसे कि आपने अभी बोला कि एचपीवी इंफेक्शंस बेसिकली स्किन टू स्किन कांटेक्ट से ज्यादा फैलते हैं, राइट मैम? सो व्हाई आर वी विटनेसिंग a rise in HPV infections, especially in Indian women, particularly in the recent years?
No, it the HPV virus is only affecting a women. That is also a wrong information. It affects both males and females. The
जी,
fact is, it is given importance in female because of the cervical cancer, which is
हाँ जी,
HPV related. But
जी,
HPV viral infection affects both men and women, and it transmits from both men and women. So it because of the cervical cancer, and because we are targeting cervical cancer prevention, we want to eliminate that cancer. So more thing is that it is more in the women, but it is not like that. Even HPV infections are seen in younger, so what we can say, kids, they have seen in the children's and everything. So it is not like that it is only pertaining to women. One more way of transmission is when a woman is pregnant and when she is having a vaginal delivery, what has happened is the baby passes through the vagina. So what that baby will swallow the vaginal fluid. That's a normal mechanism. If that vaginal fluid is having HPV, the baby will get laryngeal papillomatosis. That is an HPV infection due to
जी,
HPV infection. So these
जी,
are the reasons why we have to prevent HPV infections. To prevent all this side, what are the, we can say, the because of HPV, these are the consequences which are occurring. So it's not only pertaining to women; it is both for it affects both men and women.
हाँ जी, राइट, राइट मैम। एंड अभी हमने एक बात और भी आपसे जानी कि हाइजीन इश्यूज, ये जो हाइजीनिक रहने का एक तरीका है, दैट इज ऑल्सो अ वेरी इंपॉर्टेंट रिस्क फैक्टर इन द contraction and of course in the development of HPV infections. So other than that, ma'am, do lifestyle and socio-cultural factors in India particularly contribute to this increasing prevalence of HPV infections?
See, HPV is since many years. It was discovered in 1918. Since then, but we in India we don't have the exact data. What is our how many population our is infected with HPV? Whatever we have the Western data because they are doing studies since long. And
जी,
according to the Western culture, if you see, it is said that HPV is as common as common cold.
okay,
HPV is known as the cold of vagina. ऐसा बोलते हैं कि it's as common. So 5 out of 4 person, I'm saying not male and female, person will have HPV in their life. So it's
जी,
that common. And now the lifestyle in India, because we are Now, in a developing country, we have a technology, we have a moving population, we have students who are studying, they go to different places. So that way the HPV transmission can increase. Okay.
जी
And
जी.
next thing is the women also are delaying pregnancy, and we have a free lifestyle. Now,
हाँ जी.
before our country was a conservative, we used to believe in promiscuity. But now things are changing. Even we see the sexual freedom is there, and so because of that the transmission can increase. So that is the way the prevalence in India is increasing, but we don't have the exact data. Whatever studies we have for HPV, what is their individual, what we can say a cohort, or we can say individual institute doing study, or वैसे we have the localized कि इतना HPV prevalence है, but that cannot apply for whole country. उसके
जी.
लिए we have to do a mass screening, then only we can come to know what is the incidence in our country. But
हाँ जी.
this lifestyle, especially the mobility, the traveling, the education, and the what we can say the occupation, and people are moving here and there, so that is the way the HPV prevalence has increased.
Right, right, ma'am. Right. And now coming on to something which can actually, help with the identification of this condition. शायद तभी इस पे हम थोड़ा regulation या
Hmm.
control लगा पाएंगे. So,
Okay.
how effective are
Hmm.
current screening methods like pap smears and HPV DNA tests in early detection of infections in Indian settings?
So Indian setting, we have been total failure in by pap smear. If you see in
Okay,
the Western country, US, Europe, and Australia, pap smear is seen since lines 1950s. Okay,
okay,
HPV came in 1980s. Pap smear is in 1950. That time it was said that cervical cancer was occurring, but nobody knew the cause. And
जी,
since then, pap smear was there. And if you see in America, because of effective pap smear screening, the cervical cancer from second came to ninth.
जी,
Australia is in verge of elimination of cervical cancer because of very effective pap smear. In
हाँ
our
जी,
developing countries and mid-income countries, we come in mid-income. The main failure is we don't have a Indian-based organized screening protocol, and that is why we have failed in a pap smear screening, because it is not possible for the India, because India was developing. We don't have organized screening protocols, and women were not called for pap smear, and that is the why pap smear is failed in India. If you see
okay,
developing countries, we don't have organized it. And second thing is it needs infrastructure. It will need a cytopathologist to report pap smear. It is not easy. Not everyone can do pap smear reading. You need to have the what we infrastructure this, and in our country huge population, we don't have a balance medical system infrastructure, so that we have been failed in the pap smear screen. But coming to HPV, HPV is also not new. It is since last 10 years the HPV testing has come. And recently HPV testing has come in India also. Now you see the testings are going on. The benefit HPV testing is that is more sensitive. And
okay,
secondly, what is that HPV testing is a PCR based machine testing. So a technician
जी,
can do it. You don't need a specialist. Even
हाँ
in a
जी,
rural area, if a technician that, so that is a difference. And it is
हाँ
more
जी,
sensitive. So the screening is longer. For pap
हाँ जी,
smear, it is every 3 yearly. You have to call the women again and again. That is not possible. If you ask any women, working women is no time.
जी,
India, you go for a screening, matlab it is a half day holiday. I have calculated. Women has to go by a car, by a traffic, parking karo, you go in the hospital. So that's not possible.
हाँ
HPV
जी,
has a benefit because it can do a self test also. You can do at your home. So these are the different things. Both technologies are good. Pap
हाँ
smear
जी,
has been effective for 50 years and it brought the cervical cancer. The both technology are good. But in India, we pap smear we have failed and HPV is new. So the time only will answer what will be the best. But for our country, HPV testing has to be one of the best modalities to control cervical or to eliminate cervical cancer in future.
जी, जी मैम, जी. एंड अभी रिसेंटली मैं इसी से स्टार्ट करूंगी कि यहाँ हमारे यहाँ एचपीवी वैक्सीनेशन पर भी काफी चर्चा की गई है और उसकी इम्पोर्टेंस पे काफी स्ट्रेस दिया गया है. तो अब आप ही से ये जानना चाहेंगे कि व्हाट रोल डज द एचपीवी वैक्सीनेशन प्ले इन प्रिवेंशन एंड हाउ एक्सेसिबल is this vaccine in India?
One has to understand cervical cancer elimination goal was made by WHO
जी
in 17. It is during 2017 they come with an idea. I think so. It was during COVID times. The WHO came with a vision of elimination of cervical cancer. Why it came? Because of the effective screening method we have, that is HPV testing, and second is vaccination. So they
जी
came with a target 2030 for elimination of cervical cancer. So
जी
cervical cancer elimination has three pillars.
हाँ जी
First is prevention of virus infection. We know now HPV is the cause and we have a
जी
vaccine, so prevention. Second pillar is screening, that is you do a testing. And third pillar is you identify the patients and treat them. So
जी
vaccination is a main pillar. You cannot only control cervical cancer by one modality. You have to have all modalities. So
जी
vaccination plays a very vital role in prevention of HPV infection, and that infection will not only prevent cervical cancer but many other cancers happening due to HPV. So it is a very important vital role. Coming to India, the awareness is very, very poor. Recently, last year, I think so, there was a fake death of a celebrity, and suddenly the vaccination has risen. Now, people do inquire for vaccination, they are coming forward, but still the vaccination is very, very low.
जी
And for looking into the feasibility of vaccine, we have an American-based company which is having vaccine, and we are proud now we have our Indian indigenous serum vaccine, and that is much cheaper. So definitely, India stands a very good stand at present for vaccination. But the
जी
thing is awareness and its uptake has to be there.
जी जी मैम एंड एक छोटा सा सवाल मैं इसी से रिलेटेड और करने वाली हूँ कि क्या एचपीवी वैक्सीन को हमने या इंडियन गवर्नमेंट ने अभी तक अपने नेशनल इम्यूनाइजेशन प्रोग्राम का हिस्सा बनाया है या फिर उसको इम्प्लीमेंट किया गया है?
अभी तक तो it has not been implemented, but
जी
in last budget, our
जी
finance minister has put an issue about HPV vaccination,
हाँ
and
जी
soon it will come in in the
हाँ जी
what policy. And what is happening? Yesterday, today morning only I read that Telangana government is planning to do vaccination for girls from 9 to
जी
14 years. And many
जी
of the, I think so, in the Mizoram in our country, they are doing vaccination for the girls. Even Punjab has come, Rajasthan has come. So each and every state will decide. But definitely, vaccination for school going girls will be normal. I think so. It will be there in the near future, in time to come. But it will take time because we have a huge population, and to
जी
vaccinate the whole thing, it's not that easy. We have, as a government, if you think they have many things to address, so it will
हाँ जी
be in the pipeline in future.
हाँ जी हाँ जी बट एटलीस्ट स्टेट लेवल पे दे हैव स्टार्टेड आई थिंक स्टेट लेवल
Many
इनिशिएटिव्स हैव
states
ऑलरेडी
have
बिगन.
started. Yes,
हाँ
yes.
जी जी मैम जी. और अभी एक थोड़ा सा सवाल इग्नोरेंस पे जो कि आपने अभी बताया कि ज्यादातर महिलाएं हमारे देश में ना अपनी खुद की सेहत को लेकर सबसे ज्यादा लापरवाह होती हैं, क्योंकि उनको सबका ध्यान रखना होता है तो वो खुद को भूल जाती हैं. तो इसी
Yes.
से रिलेटेड एक मिलता जुलता सवाल है मेरा कि व्हाट कुड बी द लॉन्ग टर्म हेल्थ रिस्क इफ एचपीवी इन्फेक्शंस इन वुमेन आर इग्नोर्ड?
See, HPV infection in women, HPV infection in both the species.
जी
ठीक है, मेल और फीमेल, क्योंकि एचपीवी वायरस डिफरेंशिएट नहीं करता. इट इज
हाँ जी
अफेक्टिंग बोथ मेल एंड फीमेल. एंड
जी
एचपीवी, इफ यू सी फॉर विमेन, इट इज रिस्पॉन्सिबल फॉर सर्वाइकल कैंसर, वल्वा, वजाइना, ये सब विमेन रिप्रोडक्टिव पार्ट है. ठीक है.
हाँ जी
इफ यू सी मेल्स, तो मेल्स के पिनाइल कैंसर, एनल कैंसर, स्पेशली हु आर होमोसेक्सुअल्स, anal cancers are very high. Okay.
हाँ जी
And if you see the, if somebody is into oral sex or something, then oral cancers are very high because
राइट
of HPV virus. So
हाँ जी
HPV is not differentiating it, male and female, everybody are getting HPV.
हाँ
And
जी
second thing is, if you see a child, a baby born who are through a mother who is HPV positive is getting laryngeal papillomatosis. So these are
जी
all consequences of HPV. And third thing is, HPV is not only causing cancer, but it is also causing warts that are
राइट
like massa type of lesions which are occurring in the private part, and there is no treatment for it, and it is highly infectious. It keeps on growing and growing. It will destroy your life. So these are all things are recommending for HPV. HPV is responsible for warts, pre-invasive cancer, and cancer. So it's a wide thing. And
हाँ जी,
yes, we definitely have to look into this matter, and we have to think how to prevent this HPV infection. We cannot, it is a very common infection, but there are remedies and we have to think over it.
हाँ जी, राइट मैम। और अभी आपने एक छोटी सी बात हमें और भी समझाई थी कि इंडिया में क्योंकि पॉपुलेशन हमारा बहुत ज्यादा है, अवेयरनेस कंपैरेटिवली कम है, एंड विद द एक्सटेंसिव एक्सपीरियंस यू कम विद, I'd like to ask that what challenges do healthcare providers like yourself, face in promoting HPV screening and vaccination in rural and urban areas?
See, healthcare promoters like me, now what is happening? We have started knowing the cause and we are working over it. As a healthcare promoter, what I am doing a pilot project since last 3 years. We are
जी,
getting HPV positive. I've done more than 500 tests, and we are
जी,
getting positive test also. And what I have seen two things because I started giving the self test. I wanted to promote self test because it's easy. I can
हाँ
do
जी,
at your place. I
बिल्कुल,
started giving to doctors. You get motivate your patients to do self test.
हाँ
But I
जी,
have seen hindrance in the doctors also, healthcare
जी,
providers. They themselves are not aware about HPV. They don't know
राइट,
how to discuss with patients also, women also. We don't call
हाँ जी,
patients. These are all healthy women. So
हाँ
they
जी,
don't even. It's there for them to difficulty in how to explain HPV to them.
हाँ
And
जी,
what, because if you say HPV virus, they will Google it and they find sexually transmitted, so they don't want to come. Okay.
जी,
Why pap smear? People used to say कि pap smear चांदी की तपास है, ऐसा है. So that
अच्छा,
was something acceptable, easy to talk.
हाँ
But
जी,
HPV is a very much hindrance in the doctor's medical faculty also to communicate with the women. So the information is not going correct and women are not getting motivated. Second thing, even if the HPV is positive, if you see so many, around 60 women came positive, only 35 came for the follow-up. Why? Why 35? उनको fear है कि नहीं मुझे ये infection, they sometimes correlate HPV with HIV and they think over that. It is not that. It's different. It's not HIV, it's HPV. It's a different infection. You need not worry. It's not going to develop cancer overnight. But you have to be vigilant. So
yes,
this message should go and women should come forward. I've seen so many patients HPV positive, but they don't come for follow-up. They don't go for treatment. So this is a very bad hindrance for the follow-up also. So policymakers, I think so. Some policymakers from the government, if they take some strict action that everyone has to get tested, it has to be a protocol. Like in US, no, everywhere, if a woman is going for a job, she has to have a health checkup, but she has to have a pap smear. Then only you get a job. So such type of policy has to be made. If you have insurance, you get insurance only if you're HPV positive. Your mediclaim can pass only if your woman has gone or cervical cancer screening, whatever, pap smear or HPV. Then I think so it becomes one type of protocol and people will start following it. So lots of work has to be done at many levels, at individual level as a health worker also. Even as a doctor, we have to learn again and
जी,
start learning how to promote HPV testing, how to promote vaccination, and
जी,
so on. Even
ओके,
for vaccination, if you're telling a women to get vaccinated, one has to be vigilant that vaccine, whatever we are giving, it's a quadrivalent vaccine and a nanovalent vaccine. So it is going to cover 4 viruses or 9 viruses. But the cancer causing viruses are around 40. 12
जी,
to 14, 15. So there,
जी,
even you are vaccinated, you have to get yourself screened. So this message also a health worker has to. You just don't vaccinate and baat khatam. To tell
हाँ
them
जी,
you are vaccinated, but you have to get yourself screened. So these all
जी,
message should clearly go from the health work people to the women and to the general, what we can say, the population and everyone.
जी मैम, जी। और अभी थोड़ा सा आपके पर्सनल एक्सपीरियंस से मैं पूछना चाहती हूँ, बिकॉज यू बीन हेडिंग अ डिपार्टमेंट इन अ वेल नोन कॉलेज एज अ प्रोफेसर एंड हेड, सो मैम, क्या आपके हिसाब से स्कूल्स एंड कॉलेजेस दे
Hmm.
आर वेल इक्विप्ड टू एजुकेट adolescents, about HPV and its prevention?
See, now the things is sex education is going on in adolescent because it is very important. the adolescent to get a correct information. Social media is studied with all this information, and there's a new initiative going on the school colleges explaining about menstrual health, explaining about menstruation, explaining about sex, explaining how to take precautions. So I think so HPV should be a part of it. We have
जी
to explain our adolescent that this is an infection you might get through sexual activity, but you might even get through non-sexual activity. You have
जी
to be careful, and you have to promote. The adolescents are the best people, I think so, to spread messages. They will
जी
Google, and they will be the people. If you tell an adolescent, get your mother's get screen, you take vaccine. So those people are the spreading of the, they are the we can message spreaders.
हाँ
So I
जी
think the school and colleges are the best way we should target and make our people aware. If they
हाँ
don't
जी
take now, but even future they may take when they are independent to take decision for taking vaccination or testing. In our country, we adolescent are not that what independent to take their own decision. In
जी
US and everywhere, the adolescent will take a vaccine if you tell them. They don't have to take consent. In here, I cannot tell even a 16-year girl is saying, "मुझे ये vaccine." They read and they come to me. Okay, I want
जी
look. You talk to your mother, you talk to your parents because our culture is different. Then you
हाँ
come
जी
to me. Bring your mother, bring your parents. So you know, ma'am, you give no, no nothing like that because our culture
हाँ
is different. We are changing,
जी
but it will
जी
take time.
हाँ जी बट आई थिंक आपने बिल्कुल ठीक बात बोली है दैट दे आर द बेस्ट यू नो हु कैन एक्चुअली एनकरेज यू नो स्प्रेडिंग
Encourage.
इन्फॉर्म द डिसीजन मेकिंग में उनका बहुत बड़ा एक रोल हो सकता है बिकॉज अल्टीमेटली वैक्सीनेशन एंड सेफ प्रैक्टिसेस पे बिना सेक्स एजुकेशन की हम बात नहीं कर सकते हैं सो इट्स इम्पोर्टेंट कि हम बच्चों के साथ साथ उनके पेरेंट्स को भी काउंसिल करें ताकि एक ओपन कम्युनिकेशन में सारे आए एंड they can also understand that talking about a particular infection is not harmful, rather it's protective for their children. Right, ma'am?
Yes, yes,
जी जी मैम जी और अब मैं इस बहुत ही बढ़िया से इंफॉर्मेटिव से सेशन को समराइज करने के लिए आई जस्ट आस्क वन कंक्लूडिंग क्वेश्चन दैट
yes.
व्हाट की प्रिवेंटिव एडवाइस do you give to your patients to reduce the risk of HPV transmission? And how do you tailor this guidance based on age or awareness levels?
See, as I said, there are three pillars for HPV related We just, I don't talk about cervical cancer now. I said HPV infection. Okay, so any
जी
women coming, so I tell them that you are risk for two cancers. One is cervical cancer, which is not talked about because it is a private thing, so it's like a taboo. Breast
जी
cancer, people are aware, they want to do everything for that. Even a 24-year girl run and do an mammography, which is not needed. But
जी
for cervical cancer, you are not aware, so you should get aware. Second thing, the primary prevention is to protect yourself.
जी
For the young generation, I say you have a safe sex, but even condom is not protective for HPV because
जी
this HPV is skin to skin contact. So the
हाँ जी
area which is not covered by condom will transmit HPV. So the best way prevention is you take a vaccine. That is the best way prevention because we cannot discuss into the lifestyle or person's own choice. I cannot say, no, this is correct, this is wrong. That is your choice. Okay. But you protect yourself by taking condom. You said condom is not protective, so I don't use. No, you have to use to protect from HIV. Okay. But
जी
for HPV, you have to take a vaccine. That
हाँ
we have
जी
to tell them. And women from 9 to 14, two doses of vaccine. From 14 to 45, everywhere it is 45. Indian guidelines is 26. So you have to take three doses of vaccine. And this vaccine is not only for girls, but for men and women, boys and girls both. And any women coming, she's married more than 3 years of marriage, I recommend you have to get yourself screened for cervical cancer. Either do pap smear if you're not comfortable with HPV or go for HPV testing. Second thing, this HPV testing, whatever is not one time, आज कर दिया तो बात खत्म. No, you have to get it every 3 yearly or 5 yearly, depending upon the protocols. And if you are positive, to get yourself treated because this
जी
HPV infection gets at the age of 26 and cancer happens at the age of 45. So you have 10, 15 years of your life to control this cancer, to eliminate this cancer, and only will happen if you are morally responsible. As a doctor, I'm not going to run after you. but
जी,
you have as a individual responsibility. When corona happened, we all went for testing, all went for vaccination. So you as an individual should take a lead and move forward and get yourself tested and vaccinated in your
जी,
family. For all men also say कि all your women in the family should wear. Many of the men comment कि मेरा भी टेस्ट कर दो HPV में. Still that protocol has not come in India. But you vaccinate yourself or vaccinate your wife
जी,
or your daughters or
जी,
test your wife. That is more preventing than
हाँ जी,
testing yourself. So this
हाँ
thing
जी,
happens when you counsel them for
जी.
uh, what we can say HPV infection and screening and vaccination.
सिंपल मैसेज है कि सेल्फ
Hmm.
प्रोटेक्शन एंड प्रोटेक्टिंग योर फैमिली इज द की हियर। आप आइए
Hmm.
अपने डॉक्टर से बात कीजिए तो आप और आपका परिवार दोनों ही एचपीवी इन्फेक्शन से सुरक्षित हैं, राइट मैम?
Hmm. Yes, yes.
ठीक है। So on that wonderful note, ma'am, I deeply appreciate your presence with us today, and I have high hopes that this session will prove to be incredibly beneficial for all the families, especially the women of the families. So thank you so much for joining us today. It's really been a pleasure.
And I always thank the people like you, or we can say companies like you, healthcare system, people, because now the youngsters are 50% on the social media, and you people are taking such initiative and calling us for this awareness talk is very important. Sometimes as a doctors we say then they say they have something in their mind, ये डॉक्टर को पैसा मिल रहा होगा, ये डॉक्टर इसीलिए बोल रहा है. But people like you, when come forward and spread awareness, then definitely it will go to many areas of the medical field, non-medical field, and many in the general population. So I appreciate your initiative for spreading awareness.
Thank you so much for your support, ma'am. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.